Very good morning. This is Dr. Deepa, Department of General Pathology, SRM Dental College, Ramapuram. Every subject will have few terms that are very important and will be repeated throughout the chapter. Just like that, in pathology, we have few terms that are being repeated and they are pathology, pathogenesis, etiology, morphology, diagnosis, prognosis, idiopathic and iatrogenic. Pathology is the study of cause and effect of disease. That is, patho means relating to disease and logy means study. The structural and functional deviation from the normal that constitute a disease is what pathology is. That is, it is something that is away from normal. Apart from normal, whatever deviation is there, that we consider it as pathology. We all know different diseases caused by different agents or factors. Etiology is nothing but the cause of the disease. The agent or the factor which causes the disease is what etiology is all about. Pathogenesis is the process by which a disease or disorder develops. It can either include factors which contribute not only to the onset of a disease or disorder, but also to its progression and maintenance. So the disease process and its progress is what pathogenesis is about. Morphology means the biological study of the form and organization of living things. Under morphological features, we have microscopic and gross appearance. Gross appearance is gross pathology refers to the macroscopic manifestation of disease in organs, tissue and body cavity, whereas microscopic appearance are those features which could be seen only under the microscope. This is the term that defines the process of determining the nature of the disease. It helps us to distinguish it from other possible conditions. There are different types of diagnosis. The first one is provisional diagnosis, which is based on physical examination and also clinical findings that we come across in the clinics. Histopathological diagnosis is done by the pathologist after examining sample tissue under a microscope. The final diagnosis is the diagnosis that is done based on both the provisional diagnosis as well as the various investigation that has been carried out. It is called as the final diagnosis. Every subject will have few terms that are very important and will be repeated throughout the chapter. Just like that, in pathology, we have few terms that are being repeated and they are pathology, pathogenesis, etiology, morphology, diagnosis, prognosis, idiopathic and iatrogenic. Idiopathic is a Greek term which means idios one's own and pathos is disease. So literally the meaning is disease of its own or the illness that isn't connected to any particular cause. Or in a simpler term, we can say idiopathic is the disease that is arising from an unknown cause. Iatrogenic. Iatrogenic is illness caused by medical examination or treatment. In other words, the result of diagnostic and therapeutic procedure undertaken on a patient can lead to iatrogenic diseases. In simpler terms, the best example for iatrogenic disease is the side effects which are caused by drugs which are given by or prescribed by doctors. This was a brief introduction of various terms or terminologies that are used in general pathology. Hope this was of some use to you. Thank you.